There's curable and non-curable STIs, but I think the most, I want to say scary, but not so scary, the ones that we really need to look at is uncurable STIs. What are they? What do they look like? What are the symptoms, and how long does it take for the symptoms to show in our body or on the host? Please make sure that you join me for this Clinical Monday as I speak uncurable STIs as we shine the spotlight on STI and Condom Week right here on Oral Pop and Chats. Clinical Monday with Sister Benedictor and Nhlapho. The conversation is coming up now. Clinical Monday, the best way to begin a healthy week, live on Oral Pop's Facebook page, on X at @n_health, also on www.popn.org, with our YouTube channel, tagging Anoble with the hashtag Clinical Monday. Welcome to it. My name is Nkosi for Oral Pop and Chats. Thank you so much for joining us. Happy Monday to you and yours, and welcome. Really appreciate your time as we get to shine the spotlight on yet another clinical topic today. Since we are gearing up for all things STI and Condom Week, we are focusing on uncurable or incurable, don't know which one is the right one, STIs, and to help us dissect this, courtesy of Oral Pop in Ehlanzeni is Sister Benedictor. Actually, back in the day, back in the days, if it was like long ago, but when we started Clinical Monday, I would read their bios, but I think this time around we should know, because I think they are not strangers to the platform, so we know who they are. So Sister Benedictor Nhlapho is out at Oral Pop in Ehlanzeni. Sister B, thank you so much for your time. Good morning. It's morning still. Good afternoon. How are you doing? I'm great. So we are talking uncurable or incurable, I don't know which one is the right English, STI, because we do have them categorized like that. We have curable STIs, we have those that cannot be cured. Maybe take us through what are the STIs that are not cured for this part of the conversation.
Okay. So yes, we do have STIs that are not curable.
Yeah.
So some of those, we have hepatitis B, we have HIV,
yeah.
herpes simplex virus, and also we have human papilloma virus.
Okay, so those are the four. So it means that the ones that you have not mentioned, they are curable STIs. Does it mean that then the host body is always sick? Because when you're infected with an STI, obviously we see symptoms. They can range from being, early symptoms where you just see them a little bit to now when they're extreme. Does it mean that the body is always sick, or the symptoms are always there since they're not curable?
Yes, the body is always infected, since it's not curable, but the host may not be always sick.
Oh, okay.
Yeah, so they may not even show symptoms. Yeah. So eventually, when the disease progresses, then they start showing symptoms.
That's showing. And how long does the symptoms start showing? You look at HIV, and from the stage of when the host is infected or exposed versus to now when it starts, the symptoms are starting to be severe, and it will depend, I guess, maybe on the weeks or the months that the symptoms start to show. With these uncurable STIs, how long does it take, or it depends on the STI?
It varies.
Yeah.
With hepatitis B, it can take up to 3 to 5 months. Yes.
That's a long time. Yeah.
While they're asymptomatic, and when they start showing symptoms, it will be like the symptoms of a new infection. Now, this person has been infected for a long time, but they start showing symptoms now. Yes. So the symptoms may go from joint and muscle pain, when the disease has progressed to, remember, hepatitis, it does affect the liver as well. So when there's also advanced liver disease, there's also, they start showing signs of jaundice, and also the
this is in adults as well. Jaundice. Okay.
Yes, in adults as well. And also the abdominal distension, the confusion, the drowsiness. Yes.
So okay, go ahead.
And with hepatitis, herpes simplex virus, it's from 2 to 12 days. Symptoms. Also the symptoms where they start manifesting, a blister, a sore. So it also the itching on the anal area, tingling, also the anal discharge, painful maturation, and HIV, it could be 12 to 6 weeks.
Yeah.
2 to 6 weeks. But then the symptoms, it's just a fever, like flu-like symptoms, yeah. The headache, the fever, the chills, and they go away.
Yeah.
They should go away. And then
by themselves.
Yes, an individual can be without symptoms for HIV positive, without symptoms for a while, even years, sometimes even years.
Yeah.
But then if not managed, if not if put on ARVs, then they manifest, when the disease progresses, then they come back as diarrhea, TB, the swollen lymph nodes, all those advanced symptoms of HIV. Yes. And with hepatitis, can take about 3 to 6 months. Sorry, with HPV, with HPV. With HPV, what we can expect, the symptoms with genital warts, the anal bleeding, also the change in the bowel habit, and also the stool color. Remember, it's also bleeding there.
Hectic. I'm shocked that it takes forever. So I'm thinking it's like flu. You get exposed to the flu virus, and then you have a fever, or then it becomes a bit like that now I have flu. But then the symptoms, it takes forever. So somebody can be a host and not know that they're a host of the virus. Oh my God. So it is quite advisable that we go out there and get tested for the STIs. And if left untreated, are they deadly? Because if a virus is like in the body for like 6 months and then only starts then, and then still you don't treat it, can it become deadly?
With hepatitis B, eventually, remember, it affects the liver.
Yeah.
Liver disease, liver cirrhosis, then yes, eventually it can lead to death. HIV, yes, we do know. If not managed, it can lead to death. Yes. Also, HPV as well, because it can cause cancer. Yes. Yes. So it can eventually lead to death. But with the herpes simplex virus, no, it doesn't lead to any death. But with pregnant women, it does cause preterm labor.
Let's make sure that we check that out, or actually go out and test for these STIs, because it is possible that we are hosts and we don't even know that. I think that's the most scariest part. Let's talk about them surviving on hard surface. I had a conversation with a friend who said they had I think they call it a toilet infection, something to that effect. And then I had this question with you, does it then mean that the virus can stay on hard surfaces or on any other surface without it dying? And perhaps maybe if that's the case, for how long? And can I pick it up just by touching the surface? Well, I would not be aware that it is infected.
Yes, it varies from 7 days to 8 weeks. Like hepatitis, it could be 7 days. Herpes simplex up to 8 weeks. Under the low humidity, it can take up to 8 weeks. With the HIV, it dies as soon as it leaves the body. So with the toilets and the utensils, so it's not transmittable. With the HPV, yes, it can survive up to 24 hours on the side.
Guys, why didn't you know these things? I feel like we just take them for granted. It's like, it's just, we don't really think about it to that extent. And I think I'm glad we're having this conversation. Have you been feeling that you are, infected, or you've been exposed to one STI to another, or actually have you been and you did not know about that? Share with us some of your experiences when it comes to uncurable STIs. Have you seen an STI actually, or seen symptoms? We can't see that STI, right? But have you seen symptoms of this STI? Share your thoughts with us on Monday, right here on Oral Purpose Shares on Facebook, also on X as _health, and still joining me for this conversation. It is Sister Benedictor Nhlapho out in Oral Purpose in Ehlanzeni. Let's talk about oral sex. People when they engage will tell you about how they would favor foreplay. is that another area that we should be careful when engaging, because we might get these uncurable STIs?
So with oral sex, yes, they are transmittable through oral sex. But with HIV, the chances are very, very limited, you know, unless maybe, you know, one has cuts or an open sore.
I got you. And benefits of testing, so you know, or maybe you think that you might be infected, or maybe not even necessarily, but you know, you feel like I might be, then you get tested early. Let's talk about the benefits of that.
I can say it's peace of mind. Peace of mind, because you know these conditions might be asymptomatic, so one might have be infected but not know. So it's basically peace of mind, having to test, getting treatment, and also protecting your partner. Because once you're treated, then you don't pass the infection to your partner.
And obviously you can infect someone. Let's say both of us don't know that we unknowingly. And that time that time you've been a carrier for 6 months and the person also doesn't know. You can still infect them. That time you didn't even see symptoms, guys. This is okay. What's included in the treatment? So somebody comes and they get tested. You put them on the treatment. What's included in the treatment? What should they expect or expect when taking the treatment?
Okay. So with hepatitis we use TDF. Yeah. So now it's the PrEP drug. Yeah, because now it's combined with FTC, so there's no standalone TDF. Yes. With herpes simplex, it will depend. If maybe the host has been sexually active maybe in the past 3 months, they would get doxycycline for 14 days, for 100 milligram BD for 14 days, and also the penicillin injection as well. But then we do avoid doxycycline if it's a pregnant woman, then we give amoxicillin. And then if there's no sexual activity maybe in the past 3 months, then we give acyclovir for 8 days, for 7 days.
Okay. Got you. Partner notification process, tell us more about it. I think it's also, you know, we can learn a few things from that.
So it's basically a process of informing the partner that they might also be at risk, you know, of being infected, and also encouraging them and letting them know of the benefits of also getting screened, you know, and tested and treated, you know, if they are infected. And then with HIV, we also emphasize index testing as well. Index testing,
that's when you also test the partners or the sexual partners that might be exposed. Well, Sister B, thank you so much for your time. I think we need to be out there and get ourselves tested when we are looking at all things sexual health. It is quite important, and I really appreciate your time. Alrighty.
Thank you so much.
Thank you. So among HIV, which can take from 2 to 6 weeks, we have HPV and many others. I did not know this, and that they take so many days or even weeks for the host to start showing symptoms. Well, I think it's quite clear from this conversation with Sister Benedictor and Nhlapho that we need to get tested for uncurable STIs. And did you know that they can really exist on heart surfaces for that long? It's quite scary. Make sure that when you test for yourself for HIV, you index the next person. Also, you are part of the process when it comes to partner notification. I think we learned a few things about uncurable STIs. Let's go out there and get ourselves tested and make sure that we use a condom all the time. Not only to prevent ourselves from HIV, well, we can take PrEP for that, but to prevent ourselves from getting any other STI for that matter. That has been a conversation on uncurable STIs with Sister Benedictor, courtesy of Rampo. Until the next Monday, happy streaming.